Well, again, good afternoon and welcome to the Texas Tech Parent and Family Relations End of Semester Student Support Webinar. My name is Elizabeth Massengale and I serve as the Director for Parent and Family Relations and Assistant Dean in our Dean of Students office and will serve as the moderator for today's session. We are excited to have all of you joining us today, particularly on Veterans Day. We know many families celebrate Veterans Day, and we want to again thank all those families for their sacrifices and bravery and examples that you have set for all of us. So hopefully you all are enjoying Veterans Day. Again, we will conduct this as a webinar, so you should be able to hear and see us, but we cannot hear and see you. However, you do have the ability to answer questions through the Q&A, and we would invite you to utilize that Q&A option located at the bottom of your screen throughout the presentation. We will be recording this presentation, so you can always go back and re-review it as needed, as well as we'll be providing contact information throughout the webinar as well as at the end of the webinar. So please do not hesitate to reach out to us if you need anything else. Today's session will be focused on the different opportunities and areas of support for students towards the end of the semester. We have many panelists that are listed on your screen now from different areas in the institution, from our health area, from our academic area, and from our involvement area. They will share words of wisdom and advice and great reminders about how you as a family member can support your student at the end of the semester and make sure that they're ready to go for our spring semester. Again, these panelists are here to help answer your questions, so please use that Q&A feature throughout the time. And then at the end, we'll also maybe pull some of those Q&A questions and have them answer those live. We will also record it and have our contact information available throughout as well as at the end of the session. I'd like to invite Brittany Todd from our Risk Intervention and Safety Education area to get us started. Brittany?
Hi everyone, my name is Brittany Todd and I am the Director of Risk Intervention and Safety Education here at Texas Tech University, otherwise known as the RISE office. That is how most students recognize our area and what we do. We are the Prevention Education Office and our topics cover a broad range of topics related to student well-being and support. One of the greatest things about RISE is that a student can typically call our office and ask where they need to go for something or where they can find a certain type of help, and we can help get them to the right place or tell them maybe some of the multiple campus resources that are available to them based on what their needs or questions are. We do have a handful of services that are provided out of our office, one being something that we've started recently just to provide additional support to students during this unique time when we are less able to get out on campus and meet with students in groups and be in classrooms, kind of offering some more virtual options. For students, we can schedule individual student support appointments. If you email RISE, you can schedule one of those appointments. A student would meet with a graduate student who could just walk them through kind of what their issue is and maybe where they can go get some help or help them explore the different resource and support options that are available on campus and help them choose one or two that might be helpful for them. They can cover a broad range of topics from stress to academic support to just different things that the university has available to them. There's also drop-in group support with student peer educators, and that's just our trained student peer educators in the RISE office talking with other students just about some of the things that they're going through, the difficulties that have come through the semester with COVID or with other just general student-to-student peer support. You can register for that by emailing RISE. And then we're also offering a weekly self-care group which is a collaboration with us and the Counseling Center where we talk about coping skills, ways to decrease stress or cope with stress and anxiety, just with all of the challenges that 2020 has brought. And then, of course, ending the semester, all of the challenges that can arise with the difficulty of an end of the semester. Also, email rise@ttu.edu to register for that. Noticing a theme here. We do alcohol and other drug coaching. Those are individual and or a group appointment. This is free for any student who self-refers. So if a student's just wanting to learn more about alcohol or they're struggling with alcohol or drugs, they can certainly schedule an appointment with us. Resources, support, information, general good vibes. Students can follow, parents also can follow at TTU Rise on Instagram, Facebook, and Twitter. We are out on campus in a limited way, really safely, of course, always wearing our masks, engaging with students on campus, promotional items, and then engaging on social media on a really regular basis, talking with students on social media. We answer our direct messages during regular business hours, and that is one way that students often interact with us, most of the time via social media. So happy to answer questions, field those things. We also have a ton of information and resources available on our website, mostly getting students to the places on campus that can provide the actual service or talking to them about what they might expect if they were to go to one of those places. So happy to answer any questions. Please leave those in the chat and we will, or the Q&A, and we will answer those as we go or at the very end. Thank you.
Hi everyone, I am Dr. Amanda Wheeler and I'm the Assistant Director at the Student Counseling Center. So some basic information about our services is that we're open 8 to 5 Monday through Friday as long as the university's open. All of the services that I'm going to talk about today are available as long as your tech student is enrolled in at least 1 hour here at Tech. And all of our services are voluntary, which means we never force a student to attend our services. We want them to attend on their own. There is no fee, extra fees that are associated with attending any of our services. They are covered by student service and the health and wellness fees that you already pay for in that tuition and fee bill at the beginning of the semester. So we don't accept insurance and there's really no copay involved. The only time that your student would ever be charged is if they don't attend an appointment that they have scheduled with us. So let's talk about some of the services that we have. We have a variety of services that we offer our tech students that really focuses on mental health and mental well-being. The first one is what we call Manage Your Mood. It's a 4-week workshop that really talks about just different ways to manage your mood, how to deal with stress, how to deal with emotions, and how to cope when life doesn't go the way that you want it to. There are 2 versions of Manage Your Mood. There is a live version, which is on Wednesdays at 2 p.m. And you would just need to contact the Student Counseling Center via our website to get started. Or your student can do it kind of on their own terms and their own timeline, visiting our website, and there is a pre-recorded version of that on our website. They would just need their e-writer username and password. We also offer something called Therapy Assistance Online. This is an online program that has a lot of different information on how to deal with stress, how to deal with anxiety, depression, communication and relationships, drugs and alcohol. It's a really great program that we offer, again, that it's free. There's a lot of different videos and work activities that you can do to just kind of get those skills together without having to go into a therapy appointment. In addition, on our website, we have a variety of self-help resources that we suggest, including what we call bibliotherapy, which is just a variety of self-help workbooks. If your student isn't ready to do one-on-one individual counseling, they can do any of these other resources through their own timeline, and they can be really helpful, and if not more helpful than individual therapy. We do offer individual and relationship therapy. All of our therapy that we do at the Student Counseling Center is brief in nature, which means we're not going to see your student their entire time here at Tech. We want to get them through the difficult times, and we definitely will do that, but we really want to kind of build those skills that they can use throughout their time here. We also really just focus on mental health concerns. So we don't do academic counseling, we don't do career counseling, but we will talk about how stress, anxiety, depression might be affecting their academics. And then lastly, we do consultation with faculty, staff, and parents. So if you have any questions about your student or concerns about your student's mental health or mental well-being, you are more than welcome to give us a call. You'll get our contact information later, but give us a call and you can talk to one of our therapists and get some tips and tricks on how to work with your student. One last thing before I end, it is very important to know that everything that we do at the Counseling Center is kept confidential in accordance with state law. What that means is that as a parent, you cannot give us a call and expect for us to be able to verify if your student is receiving services. Unless your student gives us permission to give out that information, we are legally not able to give you that information. In addition, another Tech employee cannot give any information out, our Counseling Center employees cannot give any information out to any other Tech employee without that student's written permission. So it's really important to know that the students can come to our center virtually this semester via Zoom and get their needs met without having to worry about their professors finding out or things like that. Like it's been said before, if you have any questions about what the Student Counseling Center can offer your student, feel free to put it in the Q&A. And please visit us at our website, counseling.ttu.edu. It has a ton of information on there. Thank you.
And hello, everyone. I am David Trotter. I am the Executive Director of Student Health Services. I'm a psychologist by training, but I work with our director team to administer not just the mental health services at Student Health, but also the general medical services and the preventative care services. So I'm going to be talking about some of those things. I just wanted to start off by saying that I speak on behalf of myself, our medical director, Dr. David Edwards, and our managing director, Dr. Julie McCauley, that we are extremely honored to be the ones who get to work with your student to help promote their health, their wellness, and to help them through this really important part of their lives. We've worked really hard in student health over the past several years to really recruit a passionate set of providers and staff who are just really dedicated to student health, and we're really excited to do that work. As we wrap up this semester, I wanted to remind everyone of some services that we provide at Student Health. This is just a general overview of the sorts of things that we can provide to your students. We are a primary care clinic, and so we offer general primary care. So these are going to be the sorts of things that you might get from your home physician or home health home provider. We can offer those. That could be anything from preventative health work, well person visits, or management of chronic diseases. We offer a lot of same-day urgent care. In fact, actually, probably the majority of what we offer is same-day urgent care. We do offer women's health. In fact, actually, we're very excited that we, as of the beginning of this month, have brought onto staff a gynecologist who is a very well-respected member of our healthcare community locally, and she is going to be working full-time with us. So we're happy to have her on board. We do offer sports medicine. Our sports medicine team not only works with many of our club sports and our various sports here on campus, but also provides kind of sports-related injury care to our general population. And we're really excited about the services that we offer there. We do typically offer travel health, but for obvious reasons, we're not doing much of that recently. But if in the future your student is going to travel, and we do have some students who are gearing up for some study abroad services, we do help coordinate that. We can provide education on traveling safely. If people have got healthcare conditions they need to manage over their travel, we can certainly help coordinate that. We do offer a number of mental health services along with these, along with the medical services we provide in our clinic. We call those primary care mental health services. So if a student is looking for kind of general mental health services, maybe they're struggling with depression or anxiety, all of our providers are well trained in helping to address those issues, whether that is helping coordinate referrals to counseling or providing a mental health medication. They can do that. We do also offer some primary care counseling. So we have a psychologist and a counselor in our clinic who are available to your students. We also work very closely with the counseling center and refer lots of our students there. For students who need a higher level of mental health care, we work very closely with the Department of Psychiatry at the medical school and can offer psychiatric care through that contract. In fact, as of the beginning of this year, we now have a psychiatric nurse practitioner who is a faculty member in our Department of Psychiatry. She's housed in our clinic, and that way our students who need that level of care don't have to go somewhere else for the most part. We do offer drug and alcohol counseling. We've got a full-time counselor who works with our students who might be struggling with drug and alcohol issues. And that's really important. As we know from current research that given the stress associated with the pandemic, we are seeing higher levels of drug and alcohol use in the general population. So please know that we are here for your students if that is a concern. We do offer lab services. Those will be available for our students who are going to be remaining here in Lubbock. Also imaging services. We do have a pharmacy. So if your student needs to get their prescriptions filled, especially before they leave campus, we do have that on campus, and we're not a retail pharmacy, but we are a full pharmacy. So our costs are typically much, much less than you would expect to see in a retail pharmacy. And we also provide telemedicine. I'm going to talk about that here in just a second. We have made a whole bunch of changes in order to try to meet the health needs, our healthcare needs of our students as the demands have changed given COVID. So one of the things that we have worked really hard to launch is we now provide really comprehensive virtual health care. That includes both virtual health and mental health visits. In fact, actually, the vast majority of the care we're providing is virtual care. If a student calls and schedules an appointment with us, we first schedule them with a virtual health visit. That way we can, because actually the vast majority of the time, we can address their healthcare needs virtually. If they do need an in-person visit, we can certainly we can accommodate that. Please know that as we're moving into these last weeks of the semester, we can provide virtual health visits for students who are located in Texas and in New Mexico. And so just some information for you as many of our students transition to home. We are also providing mental health visits virtually, and that is available for anyone who's actually currently located in Texas. We do offer a drive-through COVID testing line that will be available even as we head into the winter break. And students can get through that line if they call the clinic and schedule an appointment with one of our healthcare providers. Given the rise that we're seeing in both depression and alcohol use, given the stress related to the pandemic, we are screening all of our students at every visit, no matter why they're coming in for a visit, for depression and alcohol concerns. And that way we can head a problem off at the pass, intervene early with all of our students. We do screen every student for COVID-related symptoms, and then we make appropriate referrals if needed. Starting next week, we will be offering free flu shots because we know that what we don't want is kind of a flu season to complicate our management of the COVID pandemic. So please inform your students that that will be available. More information will be available on our website on that. We do offer curbside medication delivery from our pharmacy. Student Health is also doing contact tracing. So if a student tests positive for COVID, we do all the contact tracing, and we coordinate that with the rest of the university to make sure that we are providing the education and giving the quarantine guidance to make sure that we can keep the pandemic numbers as low as we can on campus. For any student who tests positive for COVID, we also do daily symptom monitoring with one of our nurses. So those are some of the things that we have done as we've tried to meet the healthcare needs of the pandemic. So some things important things to think about as we transition, as we end the semester. The student health service fee covers your students' care through the end of the winter break. So their fall fee that they paid when they paid tuition will cover their health care through the end of the break till the first day of the spring semester. And if they're enrolled in the spring semester, their spring fee will cover them forward. So just because the semester is ending does not mean that your student loses access to student health. In fact, actually, as long as they reside in Texas or New Mexico, we can still provide them care. Students can have access, can gain access to their health record through the My Team Care app. And so if they've got questions about the prescriptions they have, or if they want to send a question to their provider or even request an appointment, they can also do that through the app. One other little bit of information that I want to share with people is we really strive to provide really wraparound care for our students. And here may be something that most of y'all don't know. So the Student Health Clinic is actually, we are a part of the medical school at the Health Sciences Center. And we all are employees of the Department of Family and Community Medicine through the Health Sciences Center and the medical school. Because of that, we actually have our own inpatient hospital team. So rarely our students, thankfully our students are generally pretty healthy and they rarely need to go to the hospital, but if they were to need that level of care, we actually can provide that. So students who need to be admitted to the hospital for that level of care, they are actually cared for by our family medicine team. That allows us to make sure that we have really good continuity of care coming in and out of the hospital. And so hopefully your student doesn't need that, but if they do, we strive to provide the best wraparound care that is available. The next slide. I won't go too much into this, but one of the barriers that students have to accessing care is the cost. Please know that we accept most major insurances, and most of the time there are actually no additional cost to the students. If the student doesn't have insurance, they do qualify for a 60 to 70% self-pay discount that for an urgent care visit typically is $30 to $50, which if you've interacted much with the healthcare system, you know that that's quite a bit cheaper than you would see elsewhere. And again, those services will remain available to them even after the school has transitioned to virtual and into the winter break. So please know that that is available. Here's our contact information. I do see that there are a couple questions in the chat. So our full service pharmacy can fill a prescription from an at-home doctor. We do carry ADHD medicines in that facility. We're currently not taking new patients for ADHD management, but if someone is getting a prescription filled from their home doctor, they can certainly send it to our pharmacy on the main campus. Flu shots will be offered free next week. And we do offer flu shots, and if you've got insurance, that's a covered benefit. We can give flu shots not only in clinic, but on most days, if the student comes to our pharmacy, they can get a flu shot there. And I thank you very much for the compliment. We strive to provide really good care. We wish we could offer flu shots in the dorms. We have held one flu shot clinic out in one of the parks, and that was fairly successful. But unfortunately, we can't go to the dorms. But again, if your student comes to us, we are located on campus. We're within walking distance from most parts of campus. We can get them in and out very, very quickly. And so we encourage y'all to come and send your students our way. Thank you.
Good afternoon. Shifting gears just a little bit to academics as we finish up this semester. My name is Mitzi Lauderdale, and I serve as the Interim Vice Provost for Academic Affairs. I also am a faculty member and an Associate Dean for Students in one of our colleges. So if you have any questions related to those, I'd be happy to answer those from the Q&A. But the pieces of advice that I'd like to share with you is first, when you are working with your student, to really look at the rest of the semester from an academic standpoint. The best place to start is the course syllabi. And that may sound so obvious, but put together the syllabi, lay them side by side, figure out what the deadlines are, figure out how the student's doing in each of the classes to really map out the rest of the semester. And that will really guide you in kind of the next steps. One of the next steps that you might determine is that your student needs tutoring. And we do have a learning center here that is a great resource, that is open, offering face-to-face and virtual tutoring opportunities. And so they also serve as a nice one-stop shop to identify other resources available from an academic standpoint for your student. Now, in laying out your plan for the rest of the semester, when your student puts together their plan, the student may determine maybe the likelihood of success in one class or two might not be as good as that they had hoped. So tutoring might be an option, but maybe after that they say this is not really going to work. Before you jump to the conclusion that a course needs to be dropped, there's a few things I'd really encourage you to do. First is convince your student to schedule a time to meet with their instructor of record. Where do they figure it out? How do you schedule an appointment? The syllabus should lay out how to schedule that appointment, whether it be office hours, might be face-to-face, might be through Zoom. So that will vary course by course. So in meeting with the instructor, one very important piece of advice is that your student should be very well prepared. Your student should look at the syllabus, figure out how they're doing in the class, figure out what questions that they have for the faculty member. Because speaking from a faculty standpoint, when a student comes prepared to talk to you about their status in the class, I'm much more willing to really make accommodations and help the student above and beyond what I would already do with a regular student. So if they come prepared and say, look, I don't see a pathway forward for myself, the faculty member might be able to unfortunately affirm, yes, that is the case, you really should drop a course. Or maybe they disaffirm and saying, actually, there's some other things, you have this opportunity or another opportunity, or I could put you in touch with maybe a student that's been in the class before that's successful, might be able to help tutor you out of this. So it's very important to have that communication with the faculty member one-on-one. Now, if you do affirm, your student affirms with the faculty member that the best course of action is to drop a course, you do have until the 24th of November for your student to drop a course. And so this 24th deadline typically would be late enough in the semester that it would count against your student for the 6 drop maximum that the state has imposed. However, Texas Tech University determined, because of the pandemic and the unique circumstances surrounding our students right now, we have exercised the right for exemptions that these will not count against the students for the 6 drop limit. So normally the academic calendar you see also on this slide, you would see that the drop date would normally be September 9th to not have an academic penalty, but it is extended through November 24th. I will also give you a sneak peek into the spring semester that we have made that same exemption for the spring semester. So the academic calendar is very important for a lot of reasons. We just have that link there for you to have it available, but it will have those drop deadlines. It also has other types of important academic deadlines. The last thing I want to touch on for this semester is final exams. And going into final exams, you're already aware that the university is not requiring post-Thanksgiving that students return to campus, which means all final exams will be available some sort of remote fashion. So as a student plans for their final exams, first I would have you encourage them to study sooner than later to figure out where the gaps are, because then you could point them to tutoring if they need it. Also, they need to find some sort of space that is going to be quiet, that has strong Wi-Fi connection if it's a synchronous exam. Please know that students are still welcome on campus. We want them here, they are welcome here. We just provided that opportunity for students to stay home if that is what is in their best interest. We do have facilities available. They do not have to take exams in their dorm rooms. They can go to classrooms. They can work with their academic units to help identify spaces in which are quiet if they are not able to self-identify some. Moving to the next semester, we're still working on advanced registration right now. And so while the students are wrapping up and being successful this semester, they need to be planning and looking to the future. So some of the resources they need to utilize is first your academic advisor. The academic advisor is there to assist not only on academics, but even going back to that conversation about dropping a course or not, visit with an academic advisor also. So after you visit with an instructor of record, your student should visit with an academic advisor to understand the potential implications of dropping a class. The academic advisor is there to help plan for the future. What is it that the student might be suited for academically, whether it's changing a major, whether it's figuring out the sequencing of courses. DegreeWorks is a tool that the academic advisor will point your student to, but hopefully they're there too. Once again, when you go with an academic advisor, the student should go prepared. So the students should do their own research to be prepared in visiting with their academic advisor. And then obviously their degree plan would be important to look at. So you all are very familiar with RadarLink. It's a great resource where all of these links are available for registration, for DegreeWorks, for advising. And advanced registration is sequenced, and so it rolls open based on a student's completion of coursework. So up here on this slide, we have the dates for this semester, but also a link to access it for future semesters. And keep in mind that a student could always go to their RadarLink website, and under registration, under their My Tech tab, they can look at registration status, and it will tell them when they are able to register. Our students are thriving. Our students are doing well in their classes, and having family support is wonderful, and that will help push them to the end of the semester. If you have any questions, feel free to put them in the Q&A, and I'm happy to answer those as well. Best wishes for a strong finish to the semester.
Thank you, Mitzi. I know there are a couple of great academic questions in that Q&A, and so maybe if you could just take a minute and look at those and answer them, and then at the end we can address those as needed for the entire group.
That sounds great. Thanks.
Hi, everybody. I am Kimberly Thornton, the director for the Center for Campus Life. So some of the areas that I oversee are what I call the fun stuff on campus. So something that I think has been challenging is that a lot of our students really want to get involved on campus this year, and while we've had the options, maybe they don't know about it. So these are some student involvement opportunities that we would really like you to share with your students. We have over 550 student organizations. They are thriving. They are doing great things. They are doing a combination of virtual meetings and events and different types of sisterhood and brotherhood kind of fun events that they're doing. They're also doing some in-person events. We are strongly encouraging and are requiring student org guidelines. We're working very closely with the city, with the state, as well as the university to create student organization event guidelines to keep students healthy and safe. That is our first priority. But we do want to give them the option to have some fun. So we have event guidelines. So we're seeing a lot of virtual and in-person events. Some of the virtual things are really neat for student organizations. Just some things to share with you. They're doing Netflix parties. They're painting together. They're doing a lot of things, all doing Zoom and Google. So please encourage your students to get involved in student organizations if they're not. Our fraternity and sorority life is still very active on campus. Student Activities Board, they're doing a lot of virtual events. Stuff a Critter, where you can create your own stuffed animal. There, you can pick those up and then go do it in your dorm and take pictures. So there's a lot of different things. Recreational sports is opened as well, following modified guidelines. We encourage students to work on campus. Get to know people, get to know other students, faculty, staff, attending sporting events. Football is on campus. In fact, we play Baylor this weekend. We are encouraging social distancing and mask at the games. You can do the tickets. They're downloadable. Starting, I think it was on Monday, they could get tickets. And then again, attending campus traditions. We will have a Raider Welcome Week, which is going to be the week before school starts and the first week of school in January. A lot of events will be virtual. Some will be in person. We are currently planning those. It's a great way to learn all about the different opportunities here on campus for students to get involved in. Carol of Lights is something that is going to be virtual for the first time on December 1st, where we light up the campus. So there is a link that is live on TTU's website that will allow students to watch Carol of Lights. I encourage you to watch it. It's such a unique opportunity and such a wonderful program. We have Arbor Day in the spring. I'm sure that will look a little different. We don't know yet, but that's always a great way to get involved being outside. Volunteer opportunities. We have a lot of ways for students to get involved and volunteer, of course, all very safely. And then of course, we always push our campus traditions, and learning the Fight and Matador songs are always fun. So how do students find out about these opportunities? So for us, if you want to go to the next slide, Elizabeth, for us, it's, there's a variety of ways. The Center for Campus Life website has all of the different organizations and events. It has all of our different things. Center for Campus Life is made up of a variety of different opportunities, one thing I do want to mention is that we do oversee the Red Raiders food pantry. So if students are needing food, they can't get out, you know, that kind of thing. We do have a food pantry here on campus that allows students to come pick up food, all within, you know, COVID-19 guidelines. The student involvement website has a lot of information. It has a lot of tips and tricks on how to hold virtual meetings, how to virtually get engaged, be engaged in different activities. Tech Connect is really the place that our students need to go if they're wanting to join a student organization. They can log in, they use their e-rater link, their password, and they automatically can create an account. Our 550 student organizations all have a page on Tech Connect. They all have their events down there, so they can browse the different student groups, reach out to the president or primary contact, and get involved that way within student orgs. Student Weekly involvement email. If you sign up for Tech Connect, you will get, the students will get a Student Weekly email, all about involvement, all about what's going on campus. So that's really helpful for them. And then we also have all of our social media sites on Facebook, Instagram, Twitter that can be found on our website. But you know, we're constantly posting events and ways for students to get involved, whether it's virtually or in-person events. And then all the different T2 websites and social media sites, I would suggest, you know, you follow, give your students ideas and suggestions on how to get involved. And if you have any questions, feel free to reach out to me, to anybody on my staff. We're happy to help your students or give you some one-on-one ideas on how to get students involved, whether it's virtual or whether it's in person. So with that, I'm going to turn it back over to Elizabeth.
Thank you, Kimberly. We appreciate everybody joining us today, and thank you to our panelists for participating and sharing your expertise. I know we have several questions in that Q&A regarding some of our academic areas, and so wanted to get some of those questions answered, and we just had a great one come in. Kimberly, is it too late to join an organization this semester?
Absolutely not. We are going to be having events, and I know our students are going to continue to have events all the way up until study day, even if they're not coming back on campus, whether it's virtual, which is, I think, December 2nd is study day. So absolutely not. Have your student check out Tech Connect, have them, you know, if they have any questions, call us, and we're happy to help them join a student organization.
Thank you. And then what about your awareness of various community service opportunities for students to complete, whether they're just interested in serving the community or maybe need to do that for a scholarship requirement?
So we are working very closely with the Volunteer Center of Lubbock and know that they have a lot of opportunities that will allow students to get involved. So I would say go to the Volunteer Center of Lubbock website. That would be the best way for your student to learn about the different community service hours and to sign up. And they're also following very strict COVID-19 guidelines, so it is a safe environment.
Dr. Lauderdale, there were several questions regarding some of our academic areas. I think this semester there have been a variety of courses offered in a variety of different modalities, both fully online or virtual, some of those hybrid, some of those face-to-face. We know that students learn in many different ways and maybe need some additional assistance with those courses. I know you talked about tutoring earlier. Can you maybe share additional words of wisdom from a faculty perspective on if a student's struggling with that course modality, what is their best option at this point to get the help they need to be successful?
That's a great question, Elizabeth. You know, I think the most important part goes back to exactly what I mentioned before, and that's communication. So a faculty member doesn't know that a student is struggling in the way they're receiving the information unless a student shares with the faculty member. So utilizing office hours, utilizing if there is a TA or supplemental instruction to really get additional information that they need to be successful in the course. You know, the faculty members have learned a lot during this pivot as well, and there's been a lot of continuing education opportunities for faculty that are really engaging to learn about how students are learning right now, including student panels that we had this fall for students to share with faculty what they're struggling with, what it is that's really working for them, what of it that's not working for them. So we're in a place in time that communication is more important than ever. And so I would encourage your students to speak up if they're not getting what it is that they need. But let me point to the future. Looking into the spring semester, we listened and we heard from students and parents that modality choices are really important. and having many choices to be available. So while some students are struggling with online modality, some other students are actually benefiting from that online modality. So we wanted to maintain a mix, placing priority on health and safety of students. And so we have approximately 70% of our classes going into the spring that have some sort of face-to-face component, whether it be fully face-to-face or a hybrid face-to-face mixed. And so as your students are looking at advanced registration, I encourage them to pay attention to the type of modality that the courses are in and figure out what their learning preference is and seek out those classes that align with their learning preferences. And it varies from program to program what that mix is, but we've asked the departments and they have really risen to the occasion to offer an appropriate mix of those modalities.
I know we have a couple of questions regarding the opportunity for students to drop classes up until November 24th. If a student were to drop below 12 hours, are they considered to be a full-time student or a part-time student?
So they're still considered to be a full-time student because we've already passed the date in which a student would switch from full-time to part-time. However, there might be other implications. And so you need to pay attention, for example, for scholarships, other benefits that they might be receiving to see if there are implications there. But in general, they would still be considered full-time and they would not be losing any of their benefits.
And then if you drop a class at this point, there are not refunds at this point based on Student Business Services deadlines for dropping or withdrawing, correct?
Yes, that is correct. And I would point you again to the academic calendar for that, for future semesters in which you have that question, because it will indicate whenever there is a partial or full refund available when you drop a course.
Thank you, Dr. Lauderdale. Dr. Thornton, there's been another question about fraternity and sorority recruitment and what that might look like for the spring semester.
So as far as our plan for spring for our fraternities and for some of our sororities, it will be a much more informal recruitment process. So I would encourage your student to follow the different social media sites for fraternity and sorority life. So for our Panelists, so our TTU Panelists website and for their social media sites, because each sorority for Panelists is different, and depending on a number, they may or may not be allowed to recruit. Our fraternities are always recruiting for IFC, so they will absolutely, I would follow the IFC TTU social media site. For MGC and PHC, I would encourage them to also follow the National Panhellenic social media sites and the Multicultural Greek Council social media sites, because they will be doing virtual and in-person events talking about their different intake processes, their different recruitment processes.
Thank you, Dr. Thornton. I know we had a question in here about the residence halls. We'd be happy to either answer that question. Feel free to put it in the Q&A, or I also provided you the phone number for housing, and they can answer those questions as well. Again, we want to thank you all for joining us this afternoon. We hope that this information was helpful. If we didn't answer all of your questions, or you would like to talk with somebody individually or further, please don't hesitate to give us a call or reach out in any way. The Department of Parent and Family Relations is here to help you and support you throughout your journey, and we can always get you connected with the right area. On your screen, you'll notice all of the contact information for the various departments and offices here on campus that were referenced today. And again, as a reminder, this has been recorded and will be available on the Parent and Family Relations website later this afternoon. So again, enjoy your afternoon and thank you for joining us. Take care.